Kentucky has one of the highest cancer rates in the nation, but early detection can make all the difference. Regular screenings save lives, and U of L Health is here to help with a comprehensive services to let you in on. If you catch cancer early, it can make all the difference. Joining me now to share more about that is Laura Jones. She is the Director of Oncology Screening, Outreach, and Wellness at U of L Health. Thanks so much for joining us. Such an important topic. I mean, the statistic we hear so often, one of the worst. Has it improved, and is there a reason why we've been one of the worst with cancer rates?
So Kentucky has very high rates of smoking, and we have some other environmental factors that definitely play into our high cancer incidence and death rate. We have the highest cancer incidence rate for lung cancer. Again, this is a direct correlation with smoking, but that's also why it's so important to be screened early. So changes have happened, and so we can screen more patients at an earlier age, and this is huge, and it makes such a difference. The earlier that we can catch cancer, the better the outcomes. Oftentimes, cancers may not have any symptoms. So, if we don't catch those cancers earlier, we see most folks being diagnosed at later stage diseases. And oftentimes, the intent may be treatable, but not curable at those times.
It may be news to some people that there are cancer screenings even available,
yes,
right? We
yes.
wait for symptoms to appear, and that's when it comes up. So what screenings are available, and how do you qualify to get those screenings?
Sure. So I'm going to talk about the most common cancers that we see in our state. So that is going to be lung cancer, colorectal cancer, and breast cancer. So for breast cancer, screening starts at age 40. Mammograms can happen every year. For colorectal cancer, the recommendations have changed from age 50 to 45. And if you have a negative colonoscopy, you don't have to be screened again for 10 years, which is great news. And then for lung cancer screening starts at age 50, and then those low-dose CTs are offered every year till age 80.
And what kind of conversation do you recommend that people have with their doctor in order to even get that screening?
Sure.
For me, it was my mother had colorectal cancer, and so immediately it was, well, you need to, even earlier, you need to start this. If you live with a smoker or you have been smoking, is that something that would qualify you for having that conversation with your doctor to initiate, hey, I'm concerned. Can we go ahead and get a screening and just make sure I'm okay?
Absolutely. And so those numbers that I just threw out to you those are the general cancer guidelines. But absolutely, if you have a family history, if you're a smoker, that changes eligibility guidelines. So, we can start screening much earlier for breast cancer than age 40 if there's a significant family history. We can do genetic testing to see if there's an enhanced risk, and do screening more frequently than just annually. For folks who are smokers, you are eligible for lung cancer screening starting at age 50. If you have a 20-pack year smoking history, and basically what that means is you've smoked a pack a day for 20 years, or a half a pack a day for 40 years. So that's the requirement currently, but we're hoping that those guidelines expand with our insurance program so that we can screen more people. The age used to be 55, and it's been lowered to 50, and then we see with colorectal screening that was 50, and then it's been lowered to 45. So we're really excited that insurance is expanding to cover more patients, and I think this is going to make a really big difference, especially in the state of Kentucky.
And speaking of insurance, a lot of those deductibles will hit the restart in January. Are most of these screenings covered by insurance?
Yes, most insurances will cover screenings at 100% thanks to the Affordable Care Act. However, if you find yourself uninsured or underinsured, the state has many programs to help with access to screening. So please do not let insurance or finances prevent you from being screened. Again, this is such a big issue for our state, and it's so important to catch those diagnoses early.
Certainly is important information. Thank you so much.
Sure.
To learn more, for the phone number, for all the screening information and the age that they're recommended, just go to uoflhealth.org.